Yeah, you're good.
Hi, everyone. I want to welcome everyone joining us here for a fireside chat on Mental Health Week and maybe some ways in which people can think about how to improve their mental health and address any mental health challenges they might be having during this COVID crisis. And before we begin, I just want to take a moment to acknowledge that Ontario is home to many First Nations, Inuit, and Métis peoples, and that we're grateful for the opportunity to meet on this land and to share in stewardship of this land. And I also want to acknowledge, particularly at this moment in time when hand washing is so important to people's physical health, that I want to just say the Green Party stands in solidarity with the 89 First Nations communities in Ontario who do not have access to clean drinking water. And it's something that we're going to continue to keep fighting for. And I think it's especially important in this particular moment in time. So I want to thank all of you for joining us tonight. And I want to introduce our guest. But before I do that, my team would want me to say, I'm Mike Schreiner, the MPP for Guelph and the leader of the Green Party of Ontario. And I would like to welcome Joanne Young-Evans, who is the executive director. And I always have to look at the name Joanne because Family Counseling and Support Services for Guelph-Wellington is always a mouthful. And I want to just thank you for joining us, Joanne. Joanne was a Guelph Women of Distinction Award winner in 2017. And for those of you who don't know, Family Counseling and Support Services Guelph-Wellington, they do a lot of counseling services for people in Guelph and the region, all of Wellington County. They're a nonprofit organization. And one of the things that I love about the organization is that they serve everyone. If you cannot afford to access mental health services, Family and Counseling Support Services is there for you. In particular, on Wednesdays, they have a walk-in clinic, which I think now is probably moved to a virtual clinic that anyone can walk in or access mental health services. And in the interest of transparency and full disclosure, I want to admit that my university-age daughter last summer did her co-op placement with Family Counseling Support Services of Guelph-Wellington. And I asked her how she would introduce Joanne. And so she told me, and this I just asked this about 5 minutes ago. She said that Joanne is a wonderful boss, funny and professional, and she knows how to lift people up, both clients and the people who work with her. And I asked Isabel what she thought that's my daughter, what the most important service that Family Counseling Services offered, and she said that the fact that they offer free and subsidized counseling services to so many people in need makes a huge difference in our community. So thank you, Joanne, for joining us.
Oh, Mike, thank you so much. And thank you so much, Isabel. You're so sweet. And let's be clear here, Mike. And she chose us, and we interviewed her, and we didn't pay her. She actually won a scholarship for her time with us. And so we were so proud to have her. She did so much great work, and I miss her terribly. So.
Well, there you go. Well, hopefully you'll be maybe you'll be reunited sometime in the future, but if nothing else, you'll be reunited in community space. And hopefully, as we emerge from this COVID crisis, we'll have opportunities to start seeing each other in person as we practice physical distancing now. But I think a lot of people are looking forward to those personal interactions again, which leads me to my first question for you, Joanne, is what are some tips that you have for people who are practicing physical distancing but still crave social interaction, and especially as it relates to maintaining their mental health?
Well, and what we need to do, Mike, is we need to make sure that we actually keep some structure to our day. And I know people have heard some of this material before, but they keep hearing it because it works. So you need to get up at the same time. You need to go to bed at the same time. Have your 3 meals a day. And if you're working from home, get dressed as if you're going to work. not the jogging pants and the t-shirt. Actually, you've got a suit on, a nice shirt. I'm on a warm, comfy sweater. But anyway, dress as if you're going to go to work and get in that mental prep mode. Have your work in a separate part of the home. And so that when you leave there, then you're at home. And when you go back, you're actually in the office. And reduce that exposure to news. I mean, you can be out getting some fresh air, getting some exercise, you're listening to the news, you're listening to a podcast, but try to keep listening to the news to a minimum every day. Do it in the middle of the day when you can actually then think about other things later on. There's a lot of negative things that are going on. There's a lot of fake news, to use Trump's term. So what you want to do is reduce that amount of news as much as possible. And guess what? You're going to have some bad days. Not every day is going to be puppies and peaches, or kittens and peaches or whatever. You're going to have bad days. You have bad days when you're at work and COVID-19 isn't on. Right. So realize that, you're going to have a bad day. It's okay. Don't feel guilty, and call somebody, because they're going to be on a different cycle. They're not going to have the same bad day as you. And they can lift you up, you can lift them up when they're not having such a great day themselves. And if you listen to the Premier today, I mean, they talked about the curbside for nurseries, curbside pickup. Well, now you can actually go into the nurseries as of midnight Friday night, I believe it is. So get out there, get some plants going, get some exercise. You can talk to your neighbor across the street without any problem. And you can get out to the parks, you can go for a bike ride, do those kinds of things. You don't have to stay isolated in the house all day.
And do you have any recommendations for people who are, practicing physical distancing, doing what they're being asked to do by public health officials, but yet still want to maintain social connections with people?
Yeah, you need to use Skype. You need to use Zoom, as we're doing. You need to phone people. Telephoning and talking to people on the phone, it's not the same thing, but it's reaching out and it's connecting. I know people who have Zoom cocktail parties. Now, granted, unfortunately, this is just water.
Right.
But there are people who have
my water too. So there you go.
There you go. It could be gin, but it's not. Anyway, but what you can be doing is having a cocktail hour at 5 o'clock. I know of another family who actually, all 4 families get together on Zoom with the kids and the grandkids, and they have dinner together every Sunday night. So it's not the same as being together, but at least they're hearing each other, they're seeing each other, they're laughing, they're having a good time. So set up those kinds of moments where you can actually be with one another without physically being in the same room.
And so for people who may be experiencing some mental health challenges right now, what types of resources are available for people in Guelph, obviously where we live, but also across the province that they could reach out to and get some support?
Oh, Mike, we've got so many resources set up across Guelph, across Wellington, across the province, and frankly, across Canada. I have to give everyone credit for what they've been doing over the last couple of months. So most agencies are doing at least telephone and video counseling. Okay, so you can get that either subsidized, covered with your insurance, covered with the AP, or even covered by United Way, which is a lot of what we do. And then, of course, we have things like Wobot, right? So Wobot's online. I'm going to give you some information for Wobot. And if you have a smartphone, then you can be using the app and talking to Wobot every day. And he doesn't cost anything to use. And then we also have Bounce Back from CMHA. Bounce Back is another cognitive behavioral therapy program that uses coaches, that uses booklets. Again, free of charge, excellent program that can help you get through some of these times together. Family Counseling and Support Services for Guelph-Wellington also operates Distress Line. So for those of you who aren't familiar with it, Distress Line is an anonymous phone line that runs 7 days a week, 8 a.m. to 10 p.m. Now, there's not counselors on the end of the line, they're volunteers, but they're highly trained. And they're there to listen to you. If you're anxious, you need someone to talk to, you might need some resources. And again, that number is on our website, which I'll give you at the end of our chat. And it just helps to be able to reach out and to talk to somebody. We also have a system where you can connect a loved one. It's called Teleconnect. So if you have a senior who's living on their own, you can't go and visit them, but you're very concerned. We can call them twice a day, 7 days a week. We can do med reminders. We can just check in and make sure that they're okay. So there are lots of resources in the community that can help you get through this. I'm going to give you some other websites from CMHA, from CAMH. And if you go on there, you'll find that there are a lot of self-help resources, a lot of videos that you can watch. And there's a myriad, just a myriad of resources out there now. The federal government has put a tremendous amount of money into this, as has the provincial government. They announced the 12 million for mental health funding. And some of this is going into things like WOBOT and like Bounce Back, so that people can get the help that they need as quickly as possible.
So the theme of Mental Health Week this week is Get Real. And part of that's being driven by, challenging people to be honest with themselves and, more importantly, with the people around them if they are struggling with mental health. And so I'm wondering, what are some strategies, suggestions you could provide to people who, might be afraid or struggling with, getting real and being honest with people about the mental health challenges they might be experiencing?
It doesn't help you or your family if you're not being truthful about the mental health challenges that you're having, because things can get very tense in the home. There may be abuse that's happening, and if you're not able to be honest with the people around you and tell them what's going on, and so that they can understand the depression, people start withdrawing, and then others get angry within the family, and then it causes you to withdraw more, get more upset. There could be drinking involved, abuse of other things. So you need to be able to say, look, I'm really having a bad day. I'm not coping well with this, and I just need some time to myself. Or could we just do something else? Could we cook? Could we watch a movie? Could we do something else? But hiding it is actually only going to make this worse. And actually, once we're out of isolation, that's one of the concerns that we have, is that people then are suddenly back out, they're being social, but mentally they're not well. They have been holding things in for so long that it's really, they're not themselves anymore. They're not the person that they used to be before this all started.
And you mentioned, I think one of the concerns I have is just we're seeing a rise in reports around domestic violence, and obviously the horrific tragedy we saw in Nova Scotia had a domestic violence component to it as well. And I'm just curious if you have some tips, strategies, advice for people who might be experiencing domestic violence, particularly at this particular moment in time when we're being told to stay home, but home might not be a safe space for you.
Yeah. As you know, Mike, we run violence against women programming at Family Counselling. Although we're not doing groups now, we still are connecting with our female clients, making sure that they're okay. There's a number of strategies actually that both women and children and men, frankly, because there are men who are abused as well, that they can adopt over this next little while. One of the most clever things that I've seen is you have a friend, a good friend, and you set up a signal system with them. So you might be talking to them on the phone and your signal might be French fries. So you could say, I'd really like to have some French fries for lunch today. And that would be the signal for the friend to call 911. And then the police can come over right away. You need to be able to get the word out that you're having problems, and in order to do it in a safe way so that something worse doesn't happen to you at home. So try and set up a signaling system with somebody outside your home if you're concerned that you or your children are in danger, or if your children themselves are in danger. And this can happen to anybody. It doesn't matter. It can be any walk of life, any race, gender, any occupation. It doesn't matter. We've got instances in that come to the office of people who you'd be quite surprised about the situations that they're in. So it doesn't matter who you are, this can happen to anybody. If you can get alone in a bathroom, in a car, with your phone in order to make a call if you're having trouble. The other thing you might want to do is make sure that your devices are all unlinked in your home. Now, I'm a Luddite. I can't tell you how to do that. But if your phone, say, is connected to your computer or to your tablet, then your partner can see who you're texting and who you're calling. So you want to make sure that none of your devices are linked together so that when you're making calls or you're doing that text that you need help, they're not seeing that, and then matters get worse in the home. And also remember, I mean, if you're in a situation where perhaps you're already separated from your partner, that the courts, COVID-19 is not a reason for a spouse or a partner not to see the children. So you can't deny someone access to the children if they have the right to see them and be with them, just because they're coming from a different home. So that's where the isolation piece doesn't just quite fit. And also remember, there's also been quite a bit of additional funding that's been given to the women in crisis, the shelters, so that if you need somewhere to go, there's somewhere for you and or your children to stay. You do not have to stay in the home. But the first thing you need to do is set up a signal system with a friend, and you also need to make sure that all of your devices are unlinked in your home. So there's a few tips I think people can put to good use.
Great, thanks, Joanne. I'm also wondering if you're finding that the COVID crisis is affecting children's mental health differently from adults' mental health in the clients you're seeing.
Yeah, the kids, it's interesting, Mike. Youth, and particularly now with the e-learning from the schools, youth they're expected to now be in school, do all this learning. They don't have the support of their friends, not face to face. You can't study together that way. The school environment's not there, and they have all of this uncertainty swirling around them. They're anxious. They can see you're anxious in the home because you're in the house, you're concerned, not only about COVID, but you've also been isolated for a very long period of time. So they're having a lot of challenges, and it's really important. Parents need to understand that their kids are still developing. They're developing their own identity. They're still identifying who they're identifying self. Okay, they're still developing that. And their access to social media, because they're on their phones all the time. So their access to that, their access to fake news, because they don't know the difference between what's real and what isn't. They're also going to be much more susceptible to risky situations, people reaching out, pretending they're their friends, and actually they're not. And the human trafficking, the porn that's occurring, because youth are being lured in by really incredible, I think they're called catfish and scam artists. So parents need to have honest talks, speaking about getting real.
Yeah.
Parents need to have honest talks with their kids about their social media, who they're talking to, what kind of sites that they're on, whether the sites are even legitimate. And that's one of the concerns that we have. In Wellington County, we have quite a lot of concern about the youth and what they're seeing online, and it's disconcerting. And what do I know? I'm an adult. I don't, I'm a Luddite. I'm not on Facebook. I don't know what I'm doing. But we do, and we can understand how these children are getting lured in. They're bored. They're stuck inside all day. They're looking for some excitement. And so these scam artists can attract them with promises of money, with promises of fame, which I'm going to make you a model, I'm going to make you a star, send me some pictures. And that's how the youth start getting in trouble.
And do you have any recommendations for parents just to work with their with their children to avoid them getting in these kinds of situations?
Well, it's really good to limit screen time. I mean, You can't police them, particularly if you've had teenagers in the house. You know what it's like trying to limit who they talk to and how they talk to them. But with the younger ones, you really do have to limit what they're watching on TV and limit, I mean, have a look over their shoulder. You're probably paying the bill for their cell phone or for their tablet. And you've got every right to have a look at what it is they're doing. And you try to keep, with the younger ones in particular, have them in the same room and look at what they're looking at and say, you could set up rules like, you can't be on the computer unless you're in the room with me. You can't be on the cell phone unless I'm with you, because then at least you can have a look at what they're seeing and the kind of people and the kinds of things that they're having a look at.
And if I could just shift gears a little bit, because I know we're coming up against our time here.
Seriously? Oh no.
I know, but don't worry, we'll give you. I'm watching the clock, so we'll give you time to put up the resources. But
Okay.
I'm wondering. So I love food. Everyone who knows me is I've run food businesses. I'm a real foodie, and I've always found like shopping for food, whether at the farmer's market or the local grocery store or whatever, to be such an enjoyable experience.
Yeah.
And now shopping has become almost this kind of frightening experience. Like I can feel it when I look at people and I look at the people working in stores and things like that. And then it makes me think of other people who are in other workplaces and the sort of anxiety people have, in their workplace settings, particularly now as more and more, we're talking about more workplaces opening. And I'm just wondering if you have any thoughts on helping people think through their anxiety, both as a person venturing out and participating in community and economic activity, but also for workers who are, either continued to work during the crisis, but maybe going back to work and having some anxiety around what that's going to mean for their life.
I think what people have to do is they need to look at, whoops.
There goes the robot.
Okay, he's had enough to drink. He's done. It's interesting because we deal with it obviously with my staff as well. There are some people who are extremely anxious in the office. And what you need to do is you need to show them the research. You need to show them facts. If you've got PPE, if you need it, such as masks or gloves or a plexiglass barrier, you've got the hand sanitizer, you're doing everything that public health recommends. And I think the province just came out with a new set of recommendations that are actually quite extensive. And your social distancing, the chances of you actually contracting COVID-19, if you're doing all of the steps that are required, are very, very small. And in our community, in Guelph-Wellington, we're very fortunate that we don't have that many cases. And most have been either from travel, they have been unfortunately in the long-term care facilities, not as many from community exposure. And so if you're practicing what you need to practice, if you're doing everything that's been recommended, you also have to ensure that your employer is following all of the recommendations. And if you're unsure that if your workplace isn't safe, you can certainly call the Ministry of Labor, and the Ministry of Labor will come and they will check if things aren't the way they should be, and then they can recommend to the employer what has to be done. But I think we have these conversations with our staff as well, and people are wearing masks more often. You don't have to, even if it's a scarf around your face. That in itself is going to protect you as well. And the anxiety, you probably are not going to get rid of it totally. I go to the grocery store at 7 a.m. every Saturday at Zehrs, and half of us are wearing masks, half of us are not wearing masks. Some of us are wearing gloves, some of us aren't wearing gloves. Some of us have sanitizers, some of us don't. And I think that as long as you're careful, as long as you're practicing everything that needs to be practiced, you're doing the best that you can. And you're never going to completely get rid of the anxiety, but you can't shut yourself away either, because what that's going to do is mentally cause some other issues. So I talk to people about venturing out a little every day, whether it's to the corner, whether it's walking down to the park, whether it's walking to the grocery store, picking up one thing and coming back, not often, once a week, but just to start getting out there. And it's getting yourself that exposure little bit by little bit. And I don't mean exposure to COVID, but exposure to the world and getting out of your home and not being afraid. Because we do have to get this province up and running. We do have to get our services back up and running. And in order to do that, every employer has to abide by certain regulations, certain rules. We'll make sure that those are covered. And we're going to keep you as safe as possible, because we want to keep us as safe as possible as well. So it's, you have to look what has to be done, follow those rules, and start getting used to getting out and doing that.
So my final question before we wrap up, and it'll set you up to talk about services, is I as a politician, I have to ask, what do you think the provincial government could be doing right now to help support people like yourself and other practitioners in mental health services to make sure we're providing the supports and services that people need? And then the process of answering that, if you could provide us with some information of how people can access some supports.
Mike, I'm going to answer that in two ways. I did send you a proposal, by the way, so not sure if you've got to that yet, but I did send you a proposal because you asked.
I did.
Yes. Okay. Two things. The money that has been announced is not coming down to the local services, and that's a problem. We need more money for digital communication. We need more money for video counseling. So that's the kind, we actually need some of that 12 million actually coming right down to the community. We're the ones who are, family service agencies, there's 160 locations across the province. When they're funding CAMH and the provincial CMHA, that's wonderful because they come up with wonderful resources, but that's not helping us in the local communities. And we're the ones on the ground actually doing the work, right there face to face with the public. Another issue is PPE. So I keep getting surveys that ask for my needs in personal protective equipment. So gloves, masks, gowns, sanitizer. I have to be honest, Mike, I haven't filled any of those surveys out. And the reason I haven't filled any of those surveys out is because I know that there's still some of our community partners in developmental services, in personal support workers that don't have enough personal protective equipment. So I'm not going to ask for personal protective equipment for my staff, bring them all back into the office when I know that those individuals that are having to work with clients every day in situations that are much more require much more physical contact, certainly than counseling does. I'm not going to ask for any protective equipment. And so when I know that there's more on the ground and everyone has exactly what they need, then I know I can bring my staff back and I can give them the protection that they need. But we'll continue to work remotely until I know that I've got the supplies that my staff need in order to come back to the office.
So Joanne, we have about 20 seconds. So can you just give us a few?
20 seconds.
Show us your slides.
Okay. So this is what I do when I'm at home and I got nothing better to do. All right. So I'm going to be giving these to Bianca. All right. So we've got familyserviceguelph.on.ca. And this is our website. You'll find everything about Wobot, Distress Line, Teleconnect, our walk-in calling clinics, everything's there. CMHA WWCA is our local agency, and CMHA has got some fabulous, fabulous resources, and they have counselors as well. Then we've also got the Women's Shelter. You've got Guelph-Wellington Women in Crisis. And so this is their website address. And if you need help, you call, you go immediately. All right. Then we've got Wobot. So my friend here, this is how you get a hold of Wobot. and you download them on your phone. And listen, I talk to Wobot every day. He has got the best stories. Okay, some of them are really nerdy, but he's got the best stories. He gets you the best exercises, and he really does make you feel better once you've talked to him. Bounce Back. This is a program that is being run by CMHA provincially, and awesome booklets. It's a great cognitive behavioral therapy program in print. You've got coaches that can talk to you. So this is another wonderful program, and it's a free resource. I am going to give Bianca all of these so she can post these. All right. So then we've got family service. So this is for across the province. So for everyone who's listening, who's not in Guelph-Wellington, go to familyserviceontario.org. That will give you all of the family service agencies across this province, and you can find the one that's located closest to you. Then we've got CAMH, which is the Canadian Association for Mental Health, and they've got some awesome resources as well through the hospital. And then OntarioCMHA.ca, that website is going to give you all of the local CMHAs across the province. Again, awesome resources, local agencies where you can go and get help. I want to thank the United Way, Mike, because the United Way, without them, Teleconnect and Distress Line would not exist, nor would our subsidized counseling. I also want to thank the LIN, because without the LIN, our counseling, walking counseling in Ferguson, Mount Forest would not exist. And then, of course, we work so well with the Ministry of Health, Ministry of the Attorney General, and Ministry of Children and Community and Social Services for our developmental services and our violence against women programming and all of the other programming that we have. So I do thank the province. I thank them for everything that they're doing. And we hope that once this is all over, we can get back to what we were doing before. But we're offering every program that we can, and the province is being understanding, and our clients, frankly, are being understanding as well. The first couple of weeks, we weren't very busy, and now it's like, we're going to be in this for a while, and we're very busy right now, but we've got the people to talk, and you need to call us today.
Great, Jan. Thank you for taking the time to join us today, and thank you for the services and supports you provide our community. And thank all of you for joining us, and good night. Be safe, be well.
Take care, Mike.